All right, we're live. Welcome to another Wednesday LinkedIn Live. Today's August 27th, 2025. And I'm super excited to be here as normal. As you know, I'm going to be your host, Patrick Hart. And what do? I bring you some of the freshest, some of the livest guests from around the world, Craig. And today we have a very special guest who I'm super excited to introduce you to. And let me go ahead and read this man's bio. So we're going to waste no time. Let's just jump right into it because there's a lot to unpack here. And just before we get in that, thank you once again for joining me on this ride as we introduce you to some of the dope professionals around the world that are game changers, doing instrumental things within the healthcare landscape. So let me introduce this brother to you. This is Joseph Harper. Okay. Joseph Harper is a visionary healthcare leader, dedicated people serving with over 12 years experience, transforming patient care and organizational excellence. And during his tenure as chief operating officer for Advanced Care Hospitalists, and later as the senior executive director at ChenMed, he drove strategic initiatives focused on value-based care, enhancing access and affordability for seniors. Today, as the co-founder of Perks, he continues to revolutionize healthcare through tech-driven solutions that empower individuals as well as providers. Please put your hands together. Let's welcome this brother to the stage, Mr. Harper. What's up, Chief? What's good?
What is going on, man? Absolutely excited to be here. Thank you for having me. Such an honor. Excited to talk about what we are developing, the changes we're making in healthcare, and really let's get it going.
Listen, I'm going to get all the way into this, and I know people are joining. Listen, if you're just now joining, let me make sure the comment boxes are open. Let me open this up for you guys. So today we're going to be streaming across LinkedIn, Facebook, as well as YouTube. Please put your first name, where you're streaming from, and then where you're located from around the world. That way, either myself or Mr. Harper, he can connect with you after the fact just to answer any questions that you may have. Listen, I got clean for you today, man. I knew we were talking about blockchain, cryptocurrency, all the money stuff. So I put on my green for you. Oh, and I throw in that little gold watch. I was like, okay, we're talking about money, dude. Let's get it.
Let's get it.
So listen, I just introduced you, your professional background. But before we get all the way into the company, introduce yourself personally. Who is Mr. Harper?
Absolutely. My name is Joseph Harper. As mentioned, extensive background in healthcare. Simultaneously launched my own career in blockchain, really getting involved in the community and different projects that are developing. Personally, I am a loving father of 3 beautiful daughters, enjoy fitness, staying active, very passionate about food, health, making sure, every day I take time to ground, spend some time barefoot outside, and diving into scripture, keeping the Lord in my life and making sure that I'm walking the right path as clean as possible. Over the last couple of months, I've recognized that there is a huge gap in healthcare and wanted to go ahead and make sure that I could be on the forefront of developing technology that's going to help bridge those gaps and revolutionize the way that we care for patients.
I love that, man. I love that. So not only are you, we're talking about a God-fearing man, you got a family, but you're leading with purpose, well as passion. So that's really dope. So let's get into Perks, man. Talk to me about Perks. What's at the heart of your business?
Patients are at the heart of our business, right? So we recognize that there is a continual gap in medical record sharing, communication, and care coordination for patients around the world, not just in value-based care. So what we are developing with Perks is we are developing a proof of health protocol that allows patients to verify their health records or health data on chain, in exchange, allowing them to share their health records and information with their providers 24/7 without seamless interaction. So that way we can coordinate their care and not have delays simply due to either lack of communication or the sharing of medical records. As you and I both know, it is very much a people-driven industry, right? So, if Susie, didn't show up for work, or she's on an extended leave, or she's taking vacation, medical records is at a standstill. And we've got patients that have pertinent needs. They've got results that they're waiting for, procedures that they need to make sure that they are getting accomplished and taken care of in a timely manner. And without those medical records, it's just creating extensive delay. So we've jumped in to create this protocol. So utilizing AI and blockchain, again, medical records are tracked on chain, There are designated hashtags, not similar to how you use them in social media, but designated hashtags through permission-based access from the patient that allows all of the medical providers, so your primary care physician, your cardiologist, your nephrologist, home health company, for those who have in-home services, they are able to access medical records, notes, labs, you name it, based on the permissions given by the patient 24/7.
So if I'm understanding this correctly, this is almost a reverse, as opposed to the physicians and the clinics and organizations owning the health records. What I'm getting from what you're sharing with me is now we're putting that access in the actual patient's, I guess, hands, so to speak, where they're going to have access to their own records, and they bring that with them to whatever clinic or physician that they see. Is that what I'm getting?
You got it. You got it. Right now, we are working in a siloed system. Everything is cloud storage. Everything's on servers. So the moment those servers go down, that cloud storage is gone. Those records are gone too, unless you have them filed away, hard copied, you name it. The blockchain is irrefutable, tamper-proof, encrypted. So we have this sense of security for our patients, for providers. So any health records put on chain, they are. You can't change a record. You can't delete a record. So it makes it so it's foolproof. But again, giving back the control to our patients, 90%, probably even more of the population does not physically have their medical records in hand or even stored on a device where they can go to a new provider and say, hey, here's all of my medical records. This is my history over the last 15, 20 years. For that provider then to do an accurate assessment and care for that patient the way that they need to. Because right now, many providers, especially in the value-based care space, where they have what we call D2C, direct-to-consumer assignment. So that's where insurance just assigns a patient to a clinic because they say, hey, they are providing the best quality care, you name it. That clinic itself is getting 100 plus new patients a month, and those providers are caring for them in the dark.
Interesting. So basically, and I hate to use the word basically, but to understand what you're saying, every individual becomes their own EMR. They have their own electronic health records in the palm of their hand, and they can select, I guess, what organizations that they share that information with versus how it is today where these health systems, they own the records, and us as patients, we barely have access or know how to access our own records. And therefore, if I wanted to see someone, in the palm of my hand, I can say, hey, here, Mr. Physician, this is my records. Now you can have full access, and I grant them permission, correct?
Absolutely correct. And rather than you even having to pull out your device, you know that you're establishing care with, or I'm going to use Dr. Chen, for example. You're able to go ahead, add that provider via our CMS MPI database, and then right away, pick the hashtags that provider you're giving access to, and they'll have access to every single record attached to that tag.
All right, before we get deeper into this, if you're just now joining us, welcome and thank you once again for joining me on this Wednesday LinkedIn Live. Today we have Joseph Harper. He's a visionary healthcare leader, dedicated people service with over 12 years of experience transforming patient care and operational excellence. And during his tenure as Chief Operating Officer for Advanced Care Hospitalists and later Senior Executive Director for ChenMed, he drove strategic initiatives focused on value-based care, enhancing access and affordability for senior. And today he's the co-founder of Perks, and he continues to revolutionize healthcare through tech-driven solutions that empower individuals as well as providers. So help us understand, how does this work, man?
I will tell you, I think you present me better than I can.
That's my job, man. That's my job.
Very simple, right? A user comes, downloads our application, of course, still in development, downloads our application, attaches their providers. Once they have medical records, either interoperable through an EMR existing with that current provider, or they go ahead and upload records personally. They are then able to assign hashtags to those specific medical records and share them across the continuum of care of providers that are overseeing, the totality of their care, or essentially their care team.
Interesting. This is so interesting. It's so mind-opening. It's so different from the way we normally think about this. So what inspired you to create this company?
Gaps in care, right? Recognized too many times, especially as you're on the front lines, working with patients daily. And the biggest gripe is can't get a referral, can't get their care coordinated, aren't sure where their medical records are. They're calling in and trying to get their medical records, and you have one person that's serving 10 different clinics. You've got a 30-day, 10-day, 15-day delay of them even getting those records either to that patient or to that provider. Likewise, if a clinic is needing to share information, patient records, what do they need first? They need consent.
Right.
Why is the patient not solely responsible or house or hold their own records? So that way permissions are given automatically based on patient preference and the care providers that are serving them.
That makes me think of a recent experience I just had. Of course, I'm a veteran, right? Spent 6 years in the Army. Here recently, I went to the VA clinic and I had a crown that needed to be replaced. And the VA is so backlogged. They said it's going to be a year before we can see you to replace the crown. They said, okay, we can refer you to an outside provider, but it's going to take 6 weeks because we have to encrypt your records and then send it to a provider. And it truly did take 6 weeks. So what you're telling me is now I have access. I could easily bypass that, take this through my own potential clinic and say, here's my records. And I don't have to wait for the VA to send this over.
You're absolutely correct. Of course, as long as that provider's within network with your payer, insurance, all of that fun stuff, you'll have all of your records in your pocket.
You threw out some words like blockchain, and I think I threw in cryptocurrency. So these are words that a lot of us, we want to know more about, but we're just clueless. So help me understand some of the pitfalls and misconceptions about blockchain as well as the cryptocurrency space.
Absolutely. Yeah. Cryptocurrency, it starts at Bitcoin, right? Anybody interested in blockchain, cryptocurrency, that kind of thing, highly suggest start by taking a peek at Satoshi's white paper, understand why he thought it was super important for us to decentralize our financial system. Outside of that, misconception is that crypto is for scammers, for criminals, all of that stuff. Blockchain is a technology built to allow people to essentially be their own bank. At the same time, we have so many projects from founders around the world developing on the blockchain. And really what that serves as is a ledger, right? So you go to your bank, you go to the grocery store, you get a receipt. That ledgered item of all of your purchases, it's a ledger, right? Similarly, that's how the blockchain works, except for it is publicly encrypted. So anybody can see any transaction on the blockchain, but they're not privy to who is making that transaction. So the blockchain really is just creating a foolproof opportunity for creators, developers, innovators around the world to start a project, build a community, and seek financing in an alternative manner.
Is it safe?
Absolutely safe. Absolutely safe. Right now, we put our safety in the fiat system. Fiat system is traditionally, how would I say it, made up, essentially, right? We continue to print money out of thin air, where when we are on the blockchain, most networks have a finite supply. They are deflationary, cannot create more. And it's, again, being encrypted, being on chain, again, removes any refutable issues that could occur, especially around deletion of funds, right? Your bank can decide that they're going to freeze your account, can decide that they're going to change the amount of money in your account. We've seen countless amount of people. I woke up and I had $100,000 in my bank, but of course got in trouble because they spent it. The blockchain doesn't work in that manner. Again, it's not something that can be printed out of thin air. It can be created, but then of course it is backed and funded by the public. So one of the biggest opportunities that are coming in the space of Web3 is when a business company is able to go on chain and do an initial coin offering, similarly to going public. But in this manner, they create the supply, they hold, their certain percentage, and then they leave the rest open to the public, where right now, most of the public doesn't have opportunity to invest in any IPO if they don't have, $2, $3, $4, $5 million.
I feel like you've answered this next question that I have for you, but just to make it clear for everybody else that are listening or watching, how are you different from other providers?
Other providers right now are not in blockchain.
Okay.
Most are, right? So the biggest differentiator is that we are removing the siloed network of access. So every provider right now has their own cloud servers, has their own storage mechanism, but none of them are communicating unless they're on the same server or using the same EMR. When we migrate over to the blockchain, everybody's on level playing field. Everybody's on the same network. Even if you are on a different blockchain, they still have communication. Obviously, the space is developing and are creating a lot more interoperability in between networks. So that way, if you are minted records on one network, it's easily transportable over to another network. But again, the decentralized aspect, the encryption, and then allowing us in our essence with perks to be able to give back self-custody to the patient is going to make a world of difference when it comes to coordinating care.
Okay, I want to think about this next question in two different forms. One from a patient standpoint and one from an organizational standpoint, right? One is the organization that's providing the service, and the other is the patient that actually needs or benefits from the service from the organization. Did either one of these people or organizations pay for your services, or is they just simply adopted? How does that work?
Yeah, so from the patient's perspective, simply adoption. We wanted to leave no financial barrier for patients, for users to have access to our application, to be able to put their medical records in their pocket so that way they can be on the forefront of providing consensual access to their records and streamlining their care. So again, no barriers. We're serving the neediest population, right? You put it into perspective. Some of these folks, are on Social Security disability, $1,500, $2,000 a month. That barely pays for food, housing, transportation, as well as their medical care. So me coming to a patient saying, hey, you're going to be paying $30 a month to be on our application just isn't feasible. Now, on the flip side, because we are launching on the blockchain and are doing an initial coin offering, that is giving opportunity for the public to not only invest in an emerging technology that's going to change the way healthcare operates, but it also is incentivizing providers, clinics, and other healthcare companies around the world to adopt the technology and potentially invest or become an enterprise partner. So that way they can utilize our tokenized reward to incentivize their patients for participating in their care.
I'm glad you brought up the word tokenized because that's something that I was going to bring up as well. You said tokenized rewards, how it drives adherence, measurable outcomes without adding clinician burnout. Help me understand more about that.
Yeah, absolutely. So tokenization is the way of the future, right? So you got many stocks, many companies, houses, cars. The plethora of industries will be tokenized by 2030. By going to an incentivized or a tokenized reward system, right now patients don't really have much incentive to how would I say, take a preventative approach in their healthcare. So we've got HEDIS measures, we've got different clinical outcomes that we are driving towards to provide better health, but our patients aren't engaged to participate. So through our application, they're going to have access to what health record or what testing they have open, what measures need to be closed, what different, if they need to do an HbA1c, if they need to check their blood pressure, you name it, they have immediate access to all of those. They're able to coordinate with their provider to get those services performed, and in turn be incentivized for participating. Right now, you may have your insurance company that's going to provide, $50 a year for doing your annual wellness exam. That's not taking care of the patient today. So by our patient engaging or our users engaging in their care proactively, they're being incentivized daily. And through our proof of health protocol, essentially I look at it like this: visualize a library, right? Each book in your library is a health record. Each book is given a tag. Similarly to you go through that library and you're looking at the little numbers that differentiate what the books are by P or categorized, right? Each one is given a hashtag. So by that patient saying, hey, I'm going to give my primary care doctor access to hashtag vitals, that's going to be all of their vitals that they have tracked for over the years, that provider will always be able to access. Right now, even our most high risk organizations are not utilizing remote patient monitoring, do not have access to a patient's daily vitals, let alone how they're feeling, what they're doing, what their activity is. They see them once a month, once every 3 months, but then are also 100% responsible for their care outcomes.
So what I'm understanding, not only do I own the record as a patient, but I can get rewarded for sharing my information with different providers.
Absolutely.
Right?
Absolutely. And
All
with
right.
$30 a month can make a significant difference in someone's life.
Absolutely. So talk to me about, because it's always adoption. Whenever we talk about technology, the adoption from the people that's going to be providing the service, like the clinicians or the physicians or whatnot. Is there any burden on them from using a technology like this?
No. And if anything, only thing it's doing is it's opening access, right? Again, as I mentioned earlier, we have providers that are caring for patients in the dark. And I'm not talking about a patient just walks in and is only on a high blood pressure medication. We're talking about patients that have 7 to 10 comorbidities that they have been dealing with chronically for years. Okay. You walk into a new doctor's office and they're expected to be able to care for you like that doctor has been that's been caring for you for 10 years.
Right.
By utilizing our application, partnering with patients, doctors have access to everything. The information that they're needing to provide the best care possible to their patient is at their fingertips.
Listen, I think this technology is extremely dope from what I'm understanding right now. And I know that you're a multi-billionaire, but I got to ask you this question, man. Are you because what you're doing is really dope. It's a concept that I haven't heard of before. And I can imagine there's going to be other people that are listening to this or watching this on replay. They're going to say, okay, I want in on some of this. So are you open to maybe outside funding or potential partnership opportunities?
Absolutely open to partnership and collaboration. Again, the build and development is all self-funded, but going forward, what we are doing is we are opening up a tier level for enterprises that do want to participate, again, in our ICO, initial coin offering, but also those that want to house a specific supply of perk tokens, so to speak, where they are able to then put specific incentives towards HEDIS measures that they need a patient to complete. And I'll give you an example. One of the biggest HEDIS measures that we are always chasing is a colorectal exam. Nobody wants to go through that process. Let's be honest, right?
I'm signing up. No.
No, exactly. But now we go and we put an incentive on completing that exam. Patient is a lot more inclined to participate so that they not only are going to get the clinical outcome and results that they're wanting, but also then to receive that incentive. Likewise, within the application, we'll have different advertisements, different approaches where we are able to incentivize a user for, say, viewing an ad, or looking at a different opportunity or clinic that may be opening in the area. So that is a close collaboration that we'll be able to have with clinics interested in becoming a partner or specifically investing on some level with the organization.
Awesome. So a few minutes ago, you brought up a word that I'm sure a lot of people have never heard before, and you said fiat. So a fiat system. So I'm interested in knowing, how do you see the future of our financial system shifting from that fiat system to a blockchain?
Loaded question for sure. Right. Significant shift. We are going to see an absolute significant shift. It's been shouted to the rooftops from the White House. Those who are paying attention, we are shifting from a fiat system over to blockchain. Everything will be on chain, on ledger. It helps get rid of the noise, helps get reduce fraud. Right now, our fiat system, again, not the car company, shout out to the Italian car company, but fiat system right now is that digital number that you see in your bank account, right? That is a virtual currency where we are shifting over to a digital currency. The world's going to operate on stable coins. That's a dollar for dollar exchange, right? So I say the best adoption is when the user doesn't know that they're on the blockchain. Okay. So all we are doing is we are going to be shifting from the dollar to USDC, the United States dollar coin specifically, or other stable coins. And that's, again, that dollar for dollar exchange. That way nobody has volatility, but what that's doing is it is allowing you to then take that, so to speak, fiat or dollar. You can hold it, no volatility, just like your paycheck. Or it also gives you avenue to then put into speculative assets if you wanted to get into any other sort of decentralized altcoins, Bitcoin, you name it. One of the biggest challenges that we have in the financial system, it is slow, it's archaic, and there's not very much transparency as to what's going on. Right. Again, on the blockchain, everything is public, encrypted. Lightning speed, right? So moving cash from one place to another happens in seconds, especially when we're talking about high denominations, as opposed to days, right? So once we make that full transition over to blockchain, it'll be one of those things that you are either on board or get left behind.
So listen, folks, if you're joining, I wanted to remind you that the chat box is wide open, okay? And I try to work through your comments as they come in, but no, we're wrapping up. Only got a few minutes left, so go ahead and drop those comments right now. Also, where you're from and where you're streaming, what channel you're streaming from. We'll make sure to connect with you offline as well. So I got a question for you. Listen, technology is one of those things that it grows through education. From what I understand from behind the scenes, you and I are talking, you're launching a series. Tell me more about this series that you're launching and who is that pertaining to?
Yeah, no, very excited. We are launching our first series. So our September series of Web3 and Me will be launching in September. Just put out, our guest speakers that will be joining us in September. Really what this series is designed to do is we want Web3 professionals to speak to how they made that transition from Web2 to Web3, right? Getting into the blockchain. A lot of folks are interested in organizations that are on the blockchain or in those different networks. So we want them to share their story, share their transition, what they're developing currently in this space, and then of course tips and insights and what they would give a Web2 or today's traditional professional on how to break into the space and start to get involved in the blockchain.
Ooh, that's so interesting. Ooh, that sounds sexy. I like it. Oh, Mufasa, let's go. Okay, so help us understand, how do we connect with you if we're interested in learning more about your services or just helping partner with you or support you? How do we do that?
I'm a Web3 enthusiast. I love the blockchain. I'm committed to onboarding and helping folks understand the blockchain in a safe and effective manner. There's many avenues that you can just, jump in and run into the space and unfortunately get ran over. And when I say that, scammed, taken advantage of. So my goal and many others is to help people get into this space. So if they want to connect with me, my DMs are open. They could reach out to me via LinkedIn, X. Few folks have my personal number. Feel free to reach out to me. Again, I want to help everybody migrate into this space. I hate to say it this way, but it's one of those that I believe, in the next 5 years, if we don't adopt the technology now, you will get left behind. It's a matter of fact. But last thing we want to see is the working class become the working poor. And right now we have a once in a century opportunity to invest in the future of our financial system, because I will tell you, not one single person had the opportunity to invest in any sort of fiat system when the Federal Reserve was created in 1913.
Correct. Hey, I'm going to be wrapping up here. And as I wrap up, know this, Mr. Harper, I saved about 30 seconds for you in the end, but one more time, I want to reintroduce you to the rest of the world. If you just now joined us, we partnered today with Mr. Harper, Joseph Harper. He's a visionary healthcare leader dedicated to servants with over 12 years of experience transforming patient care and operational excellence. During his tenure as Chief Operating Officer for Advanced Care Hospitalists and later as Senior Executive Director at ChenMed, he drove strategic initiatives focused on value-based care, enhancing access as well as affordability for seniors. Today, as the co-founder of Perks, he continues to revolutionize healthcare through tech-driven solutions that empower individuals as well as providers. Hey, listen, close us out here, man. What would you like to share with the rest of the world? Maybe something I didn't ask you, or just anything that's on your heart that you want to share.
With the changes, especially in the professional world, development of AI, the integration of blockchain, we're going to see a significant dip in employment, right? There's been trajectories that will have around a 20% unemployment rate coming into the future. So I know that there are such great talent out there looking for opportunities, and the blockchain's the way to go. Get involved in the communities. If it starts with investing, every project is creating a Telegram, building a community, want to hear your voice. That's the best way to jump in. But I also want to leave folks with a little bit of a scripture that comes from heart. Is all perfection in life has some imperfection bound up with it. And no knowledge of ours is without darkness. It's these times of trials and tribulations that we really find ourselves. And if you just hold on for a moment and put your faith in Christ and learn that it takes the darkness for us to see the light, many of us will realize that there is an amazing future ahead of us, and that the universe is always in our favor. We just got to interact with it.
Love that. Listen, if you're a leader or a healthcare organization and you think that what you do is super dope, connect with your boy. Let's get you spotlighted every Wednesday, because I'm going to be here, Faction Action, every Wednesday, hoping you understand and learn from leaders like Mr. Harper here that's doing dope things. Listen, man, I enjoyed this. I thank you for your time. I wish you nothing but blessings, and I want to continue to see you grow and help other people make an extremely dope impact. So thank you for joining me today, man.
Absolute honor. Patrick, how do we do it? Let's get it.
Let's get it. Let's get it. Until next time, we'll see you next time. Bye, folks.